head model, you'll notice that you've got a bunch of muscles over here and then hardly any muscles on this side. So this is the more superficial side of the head. These are going to show more superficial muscles, whereas this side is showing the deeper muscles, and that's why you see the skull here. First muscle I want to look at is the frontalis muscle. So it's over top of the frontal bone, okay? And that is the bone that's covering the frontal lobe of the brain, okay? So that makes sense. It's called frontalis. We've just changed the ending just a little bit. The frontalis muscle is connected to a connective tissue sheath. It's called the Gallia aponeurotica, and that extends over top of the skull and attaches to the occipitalis muscle back here. So when this muscle contracts, it pulls on this connective tissue sheath, which pulls on the frontalis and helps in raising eyebrows, okay? Many of these muscles are going to tell you something about it. They're descriptive. So it's either going to tell you where it's located, what it does, what it's attached to. It's going to give you some identifying information. The next muscle I want to look at surrounds the eye. This is a true sphincter. It's called the orbicularis oculi. Ocular, eye. Okay, so it encircles the eye and closes the eye. So you can just close your eye and that's that muscle. Even if you close tight, that is that muscle working. Just below the orbicularis oris are muscles that are going to act on the mouth. Okay, so these are going to provide a lot of facial expression. Right here, it's close to the nose, off to the side. It's called the levator labii superioris. Levator, elevator, think lifting. Labii, labia, it means lip in Latin. And superioris, it's on the superior side of the mouth. So it's going to be raising the lip from the superior side. So being that it's close to the nose, when this muscle contracts and it's lifting the lip right almost under the nose, it gives a sneering kind of facial expression. So almost like, ew, yuck. Okay. The one that matches this, that's a little bit deeper, is called the levator anguli oris. So this is connected to the angle of the mouth. Okay. So it pulls up the mouth at the corners. So as in smiling, pulling that up. Out a little bit further, laterally, we've got two muscles. These are also involved in smiling and lifting up the lip and the corner of the mouth. These are the zygomaticus muscles, zygomaticus minor and zygomaticus major. Major meaning that it's bigger. Minor, it's meaning smaller. The smaller one is right adjacent to the levator labii superioris. So it's right here. So it's also going to have the same action as that muscle in pulling up the lip. The zygomaticus major is connected to a structure called the modiolus. This is out at the corner of the mouth, and so this will pull the mouth from the corners at this structure. A little bit further out, again, attached to the modiolus. And so when you're looking at these muscles that are attached here at the corner of the mouth at the modiolus, it's kind of like a bicycle wheel where you've got that center portion and then the spikes, what are they called? Spokes coming off of the bike. I ride a bike, I should know the parts. So it's kind of like they're spokes coming off of the bicycle. The next one is a horizontal muscle. It's the risorius. So it's attached right there at the modiolus and it pulls straight out. So think about that emoji that just has the flat line mouth. and that's what that one's doing. So I'm not even sure like what that it means exactly. It's kind of like whatever. All right, so now we've got some depressors. So depress, we're gonna lower, we're gonna bring something down. Depressor anguli oris is attached to the angle of the mouth, so it's gonna pull the mouth down at the corners as in frowning. Adjacent to that and a little bit deeper is the depressor labii inferioris. So similar to the levators, they've got similar names, just one's gonna lift and the other pair is going to pull down. So this is gonna pull the lips down as in showing your bottom teeth. Mentalis muscles, these are also working to pull the mouth down, the lip down. Another muscle that's pretty important, particularly in a newborn baby, is called buccinator. Buccinator is involved in suckling, blowing, sucking, okay, pursing your lips, fishy lips. This is important because within a few hours after birth, a baby is set to the mom's breast to nurse, to breastfeed. Unless, of course, the baby's going to be bottle fed, and that's choice of mom. Circumstance dictates. But either way, the baby has to have this muscle developed in order to do that suckling, in order to feed. Okay, if it doesn't, then it's going to have to require some artificial feeding. So that muscle here on the deep side, you can fully see that. You can also see it on the more superficial side. And it's under those muscles right there. Let's see where I'm at. Okay, on the lab guide, you see a muscle called the platysma, and there's 2 asterisks next to it. That muscle is not seen on this model because it's an extremely superficial muscle and it would cover up all of this. Instead, that is a muscle that you're only going to see on this coronal section over here. And so that's this muscle down here at the bottom, very superficial. It's a large muscle and it's a thin sheet. So it attaches at the corners of the mouth, attaches at the jawline, and extends all the way down to the top of the breast and out to the shoulders. So this muscle pulls the mouth down when you tighten it, so then you can see how it tightens, okay? This is also a muscle that men use when they're shaving to tighten up that area, okay, so they don't cut themselves. So they jet the jaw out and then they shave, okay? So that's when it gets tight. So very superficial sheet-like muscle. Next muscles are involved in chewing and swallowing. And in this group, you're gonna see the 4 glossus muscles. These are the ones that you'll see on the torso trunk model and the head, only one on the head model. And then you've got 2 other groups, the suprahyoid and the infrahyoid. Both of these groups of muscles I will go through in smaller groups. So I want to look at the temporalis muscle. It's this large muscle right here. And you can feel this muscle work. So if you take the tips of your fingers and put them up where your temporal lines are and clench your teeth, you should feel that muscle contract and pull on the temporal lines, okay? That muscle is attached to the mandible at the coronoid process. Okay, so it's pulling up, elevating the jaw. It also allows you to shift your jaw back and forth. Okay, so that's as in excursion. The masseter muscle is a very strong muscle for chewing. That's this one right here. It's underneath a gland. This is the parotid gland. It's attached to the jawline right back here at the angle of the mandible, so connecting to the body, most posterior, at the angle, and then all the way up the ramus to make an attachment at the zygomatic bone, okay? And you can feel this when you clench your teeth as well. So it's really tight right there. People who grind their teeth or chew a lot of gum, they will have a very tight masseter muscle. The tongue. The tongue is also a muscle. In fact, inside the tongue, there's a whole bunch of intrinsic muscles. So those are muscles inside the tongue. The list that we've got here of these 4 muscles for the tongue, these are extrinsic muscles. So these are outside of the tongue, acting on the tongue. Now we can go to muscles of the neck, and most of these are acting on the head to move the head. So first one is the sternocleidomastoid muscle. Sterno, what's it connected to? The sternum. Cleido.
Clavicle.
The clavicle. Mastoid. Where's that connected?
The mastoid process.
The mastoid process of the temporal bone. Yes, and so you can palpate this on you if you put your finger back at the mastoid process, turn your head, and follow it all the way down to the sternum and the clavicle. You can see portion of that muscle pop out as you are rotating the head, okay? Bilaterally, when you look down, that muscle is acting, it's contracting, okay, to allow your head to pull down. And it allows for lateral flexion of the cervical region of the spine. Okay, so it does both of those as well. Next muscle is the trapezius. So on this model, it doesn't look like it's a very large muscle, but it is very large. It's diamond shaped. So it attaches up here at the head, it goes all the way out to the shoulders on both sides, and then it comes down triangularly down almost to the middle of the spine, okay? This is an extensor for the head, so it's holding your head up. So when you're falling asleep in class, what jerks your head back up is the trapezius, okay? So that's one of the muscles that's helping to jerk your head back up because it's an extensor of the head. This is also the muscle that when you're working out and you're doing overhead presses, you're working the traps, okay? You're working those muscles right there. And they can get very tight. A lot of us hold our stress there. So you feel the tension up in your head because it's connected at the cap, okay? So that tension radiates up to the head. The next 3 muscles are called scalenes. Scalenes or stairs, steps. So you've got an anterior, a middle, and a posterior scalene. So all 3 of those, and those have been protracted out for you so that you can see them on this side. You can see them just barely a little bit here on this side, but this is not the best view. So these are attached to the first and the second ribs. These allow for lifting those 2 ribs in inspiration. So when you breathe in, it lifts those up. These also allow for lateral flexion of the head as well. Splenius capitis. Splenius means bandage, and a bandage is the same width the whole way. So that's this muscle right here. Capitis, we're attached to the cap. Okay, also an extensor. So this is holding your head erect. Also allows for hyperextension of the neck as well. So does the trapezius, allows for hyper. This is hyperextension of the neck when you're looking up. Semispinalis capitis, same function as the trapezius and the splenius capitis, and it's a deeper muscle. It's right here at the occipital bone, so attaching at the cap. part way. It's going part way down the spine, spinalis. And then the last one in this group, it has an asterisk on it. It is a neck muscle, but it doesn't necessarily act on the head so much as it acts on the scapulae. Okay, so both of the scapula. And that's this one right here, levator scapulae. So it's lifting the shoulder blades. In the joint checklist, you are already familiar with this. The temporomandibular joint, you know where that's located. And now you know a muscle that's associated with that. That's the temporalis muscle and where it connects, okay, the temporal lines and the coronoid process of the mandible and how it acts on that joint to raise the jaw. Then you've also got a nerve checklist. This is from chapter 4, table 1. You've got several cranial nerves. In order for a muscle to move, it has to be innervated, and that nerve tells it or triggers it, stimulates it to contract. So the most extensive nerve of the face is the facial nerve. Almost every muscle of the face is innervated by this nerve. It's got 5 branches. All of the yellow lines that you see on this model, that's the facial nerve, okay? I don't need for you to know every muscle that it innervates because just about every one that you're learning of the face, it innervates, okay? So what do you need to know about the facial nerve? It's the most extensive, okay? Innervates just about all the muscles of the face. It is going to have motor function, which means it stimulates muscles to contract. And it also has sensory function. So it picks up information about the senses. Taste is one of those major senses. When something's wrong with the facial nerve, you're gonna know it because the face will droop, okay? So in particular, the disorder called Bell's palsy. Trigeminal, vagus, and accessory. So look in your table about each of those nerves, about what it is that they do. Do they have motor function? Do they have sensory function? The next two, the glossopharyngeal and the hypoglossus, these kind of tell you what they do. So glossopharyngeal, what's it innervating? What's it innervating? Glossopharyngeal. Tongue and pharynx, yes. Hypoglossal. What's that doing? Hypoglossal. Below the tongue, yeah, muscles below the tongue. Exactly. Okay, so I will come around and work with you as